Morning Show 15 before the top of the hour. We got the one and only Dr. MJ Collier with our COVID-19 update. Dr. Collier, good morning.
Good morning, Rickey Smiley, and good morning to all the Rickey Smiley Morning Show listeners. It is a privilege to be here this morning because in the midst of this pandemic, we are seeing some dramatic things happen, Rickey. Now we have over 3 million cases in the United States, with the greatest increase ever at any point yesterday of over 60,000 cases. Now, one thing I have to say, those numbers are due to increased testing in a lot of ways because we are testing more people. But remember, we're under testing. It's thought that number could be twice the amount. And because we just aren't testing everybody, don't have the physical capability. As you've seen in some of the testing sites, people are having to wait 8 or 10 hours in their cars to try to get tested. So the testing situation is being overwhelmed. The 3 biggest states, California, Texas, and Florida, their highest numbers ever. 6 states registering their highest numbers. That's Alabama, Idaho, Missouri, Montana, Oregon, and Texas. Now, when have you heard about Idaho and Missouri? So it's showing you that the entire United States, if you visualize a map of the U.S., that this is spreading and it's spreading like wildfire. Hospital surge in capacity has been met now. ICUs are at maximum capacity. And one of the doctors was quoted as saying, it's like when hospitals think of surge capacity, they think of a single event like, say, a hurricane or something like that, or a bus accident. He said this is the equivalent to having major bus accidents every day. So it's overwhelming. The hospital staff, they're working in extended hours. They're going through a lot of PPE. It's overwhelming the healthcare system, which is exactly the problem that we were trying to avoid. But let's bring it home, Rickey. Younger people thinking this does not affect them. I have a patient that he and a friend did a 12-hour road trip from Texas back to Atlanta. They went to Texas to see friends, family, or whatever, drove back to Atlanta. It took them 12 hours. Within a day of arriving back in Atlanta, one of them was hospitalized, positive coronavirus, now on a ventilator. But the coronavirus and the ventilator are doing okay. But the coronavirus actually attacked his heart. Now his heart's capacity has diminished to about 15% of what's called the ejection fraction. That should be 60%. It's now 15%. So he's suffering and having major problems with directly being affected by his heart being involved with the virus. So the virus has attacked and attached to his heart. It's causing that. So young people, understand this can happen to you.
Right.
It does happen to you. You need to maintain your social distancing, etc. So all those things are there.
Right. Dr. Collier, let everybody know what they need to be taking.
Okay, and remember, Rick, we talk oftentimes about vitamin D, and people ask, well, why is vitamin D so important? Because vitamin D regulates the immune response. It decreases cellular secretions. It promotes growth in the gut microbiome. So the mucous membranes from your nose, your nasals, your sinuses, your esophagus, your stomach, small intestines, large intestines, colon, and rectum, all of those things need vitamin D to maintain good bacteria, which fights not only viruses, but bacterial infections and fungal infections. So vitamin D is really just a super supplement in doing so. And if you're taking vitamin D, you need to take at least 5,000 international units per day. Oftentimes, people are taking much less than that, as little as 300 or 400, if they're taking it at all, which is a total waste. You need to get benefit from the vitamin D level. You need to make sure that you're taking a minimum of 5,000 international units per day. You can have your vitamin D level checked at any doctor's offices or any walk-in lab, but it's not necessary to do that because a dose of 5,000 per day is just an ideal dose, and anybody can take it. It's not going to, harm you in any way. There's no downside, but only an upside to boosting your immune system with vitamin D. It is the easiest supplement that you can get, and it's readily available everywhere.
Right. All right. If you want to talk to Dr. MJ Collier, call 866-9-RICKEY, 866-9-RICKEY. If you have any questions, hit us up. Rickey Smiley Morning Show. All right, y'all. 10 before the top of the hour, y'all. Rickey Smiley Morning Show. Gary got the tea and the clue today coming up. Front page coming up. A whole lot more. Rickey Smiley Morning Show.